Chapter 10, Dermal or Capillary Puncture. Dermal puncture is used to collect blood samples from infants and small children. It may also be used as an alternative method of blood collection for adult patients with whom the venipuncture procedures are too difficult. Uh, so let's go to the key terms that we are going to learn for this lecture. Now, so for infants and very small children, this is the preferred method. Also for obese, elderly, and severely burned patient, this has to be needed. This is needed alternative method. In these patients, the veins are very small and it is difficult to find a vein large enough to withstand a vacuum uh, in evacuated collection tube. Also, dermal puncture takes less time, so it is more often successful. Dermal puncture is easy to perform, is often less traumatic for children. Blood specimen obtained using dermal puncture is not entirely venous blood. Instead, it is a mixture uh, of arterial, venous, and capillary blood, as well as interstitial fluid, the fluid between cells and tissues. Preparing for dermal puncture. The main difference between venipuncture and dermal punctures are site selection and equipment assembled. We have to acquire and examine requisition slip, greet and identify the patient, explain the procedure, verify any dietary restrictions, wash your hands, put on gloves. For children and adults, we should use third and fourth finger of the hand. Um, this picture is a little bit erroneous. I see it does not show that. It should be third and fourth finger. Use the palmar surface of the finger. Use the side of the finger instead of middle of the finger, and warm the finger slightly to increase blood flow. For infants, use the plantar surface of the heel. Never perform a dermal puncture on the heel of an infant who has begun to walk. Use the lateral surface of the heel, as you see marked area, well away from the calcaneus. Calcaneus is the heel bone. If the calcaneus is punctured, it can cause osteomyelitis or bone infection. Infants less than 1 year old, side of the plantar surface of the heel at the site of choice. Do not use the fingers because they are too small to maintain a safe distance from the bone during puncture. So do not use the arch of the foot. Do not use the back of the heel or plantar area, the bottom surface of the foot. These are the equipments for the puncture site. You see the alcohol wipes, gauze, uh, lancets, gloves, adhesive bandage, sharps container, computer label, permanent marker, and microspecimen container. Select a site that is warm and free from scars, cuts, rashes, or bruises. Plan to cut across the fingerprint. You see the yes, cut across this thing. Do not cut in the same direction as the fingerprint because the blood tends to run in the prints or ridges instead of forming a rounded drop. Hold the finger in the proper position and stretch the skin tightly. Position the lancet to cut across the fingertip rather than in the same direction as the fingertip print. Be sure to make the puncture deep enough to collect the amount of blood needed. Note that improper technique during dermal puncture can cause bone infection, especially in infants. Puncture depth should never be greater than 2 millimeter and should never be performed at the center of the heel, where the calcaneus is most likely to be punctured. Do not use spring-loaded devices designed for glucose monitoring. Use the device correctly. Check the directions before using an unfamiliar device. Apply a steady amount of pressure to the site before and during puncture. So time to watch a video, and after that we'll continue with the lectures.
Today we're going to learn how to do the dermal punctures on each other. Equipment you'll need is you'll need a lancet. You'll need a lancet. You'll need your capillary tubes, alcohol swabs, your 2x2 gauze. Might need some tape, and you also need your gloves. Let's go ahead and put our gloves on. I've already obtained consent from my patient and informed them of the procedure. As you see, I have 2 lancets out. You want to make sure that you always have backup equipment in case the lancet does not work. Go ahead and withdraw one of your capillary tubes. Place it out. Be careful. You might want to sit it on something that you know where it is, because it's glass or it's plastic and it'll blend in with the environment. So try to make a mental note of where it is. Gather one of your alcohol pads. And you'll want to puncture the patient's finger, one of their 2 middle non-dominant fingers. So we'll go with this middle finger and we'll point down using gravity as our friend. We're going to cleanse the fingertip. There's our alcohol swab there. And while the alcohol is drying, be aware that we do not want to stick center or medial in our patient's finger. We want to go lateral on either side. We never stick medial because there's a chance that we could puncture or break some of the bones in the finger. Also the same thing if we're doing a heel stick on a baby. We'll go lateral, not medial. Okay, so the alcohol is dry now. I have my lancet. It's already preloaded. Take off the cap. Squeeze the patient's finger and put up to the finger and push in. You'll hear it click. Means the lancet's punctured the finger. Squeeze. Wipe away the first drop of blood. With your capillary tube, red line facing down, go ahead and collect your sample. You'll try not to touch the capillary tube to the patient's skin and just dab on the bubble of blood. And you'll do this until your tube's full. Allow yourself plenty of time. At this time, it might be best to talk to your patient. It's a slow process. More likely, we'll be performing these punctures for the finger stick. We'll do on children that is past the age of toddlers up until adolescent years. And if it was an infant, we would use the heel. Sometimes we'll do this on geriatric folks. They may be a little bit anemic, or their veins cannot handle the vacutainer system. Capillary tubes are heparinized. All right, and my tube is full. Place this down on my disposable chuck. Patient a piece of gauze, and ask your patient to hold that. And this is how you do a dermal puncture. And at this point, depending on your facility, you would go immediately process your capillary tubes or take to your lab. And this is how you do a dermal puncture.
Okay, so that was a good video to watch. Let's go back to our lecture, chapters 10. So the steps are like this: assemble the equipment, Consider the patient and puncture depth. Clean the site with alcohol pads. Hold the finger and the skin stretched tightly. Use the lancet or puncture device according to the manufacturer's direction to create puncture. Wipe away the first drop of blood because it is contaminated with the tissue fluid. Should apply a steady amount of pressure to the site and hold the fingers so that drops of blood form and fall away from the site. Touch the open end of the appropriate micro collection container to the drop of the blood to collect it. Gently tap the container after each drop to ensure mixing with the anticoagulant if present. Do not milk the finger because this will contaminate the specimen with interstitial fluid. Do not scrape the container against the skin because this may cause the blood to hemolyze or clot before it mixes with anticoagulant in the collection container. When collection is finished, apply gauze until the bleeding has stopped. Patient may be able to do this. Now the topic is order of draw. This one is different from the order of draw in venipuncture. You see here, it's much more simple. Only 4 things you need to know. One is the first one will be the EDTA tube, the lavender pink tube, followed by heparin, which is green or light green, sodium fluoride or gray, and then non-additive red or serum separator gold. So lavender, green, gray, red, right? LGGR, that's how you can remember that. Now, let's talk about the complications of dermal puncture. Do not puncture through a previously punctured site. Doing so may cause the site to become infected. Also, take care not to puncture the bone, which may cause osteochondritis. Oste means bone, chondro is cartilage, inflammation is arthritis. So inflammation of bones and cartilages. Osteomyelitis is the inflammation of bone marrow and adjacent bone, that is osteomyelitis. So 3 things can happen as a complication of dermal puncture. Not collecting enough blood may cause an additional blood collection that would otherwise be unnecessary. However, collecting too much blood can result in iatrogenic anemia and exsanguination, as described in Chapter 9. Many facilities have guidelines for maximum blood volumes. Follow the protocol at your facility. Another reason for drawing just the right amount of blood is that the amount of additives in the micro collection container are based on a specific quantity of blood. Like you see here, it's the marked over there 400 or 600. So if too little or too much blood is drawn, the ratio of blood to additive is affected, which may cause the blood to clot or otherwise affect test results. You see here the example guideline for blood collection volume according to body weight, the maximum allowable blood, and the total maximum allowable blood to be drawn in 30 days. After the dermal puncture, place used lancet in sharps container, label the micro containers, check patient's fingers, and apply bandage if necessary. Collect and dispose of supplies appropriately. Thank your patient, dismiss the patient, remove gloves, and transport a specimen to the lab. Not all patients should have a bandage applied. Small children tend to put their fingers in their mouth. This puts them at risk of swallowing or choking on the bandage. So this is a short chapter, chapter 10, dermal puncture. We have discussed the dermal puncture procedures here, as well as the equipments. We also discussed the age-appropriate site for fingers, then equipments needed for it, assembly, and at the end, the complications that might arise from dermal puncture. That is end of chapter 9, 10 actually.